lot of people, one of the things that holds them up is the idea that I have to be trained, I have to be certified. If I don't do that, I can hurt somebody. This was not a certification class. This is not a hard class, so to speak. This was a couple hours of teaching these kids how to do compression-only CPR. No mouth-to-mouth, no bag valve, no pocket mask, nothing. Just get on somebody's chest and start banging away until some help comes.
Hey, welcome back to the Monday Afternoon Journal Club. Ed Bowder and Dan Schwester here from the Overrun. And we have another paper that tells you we have no idea what the hell we're doing for cardiac arrest.
That's not true. Stop. You're being disingenuous.
This, to be clear, when we were programming this wasn't on purpose. This is just kind of how it worked out. But the fun story, and this comes out of Kalamazoo, Michigan, which is the home of the minor league Kalamazoo Wings, go hockey. What we found out here, Dan, in this study is that we can teach 10-year-olds how to do effective CPR.
So why don't?
Yeah, exactly. That's the end of the Journal Club. Thanks. Good talk. We'll see you all next week.
But really, yeah, folks, this is a study out of Western Michigan that talks about teaching 4th and 5th grade kids, I believe, to do hands-only CPR. And after a couple of weeks, they went back and skills tested them, and they found skills retention was very good. It was only about a couple hours of training, could be done in a physical education class or a health class. And the retention was good enough for them to do effective CPR. So, the question here is, and we are in love with cardiac arrest resuscitation data on the Journal Club, but this is kind of interesting because one of the things that we don't see in the United States vis-a-vis other countries is this bystander CPR idea. And I think a lot of people, one of the things that holds them up is the idea that I have to be trained, I have to be certified. If I don't do that, I can hurt somebody. This was not a certification class. This is not a hard class, so to speak. This was a couple hours of teaching these kids how to do compression-only CPR. No mouth-to-mouth, no bag valve, no pocket mask, nothing. Just get on somebody's chest and start banging away until some help comes. And the retention was good. They showed that they could do it, and they could do it effectively. And the question needs to be now, if we talk a lot about improving cardiac arrest survival, which for 50 years, we haven't gotten above that 10%, 8 to 10%, depending on where you live, some a lot less, a couple maybe a little more, but for the most part, you're looking at 8 to 10%. Might this improve survival? Well, if we have a whole nation of people who are trained how to do CPR right away, we might.
Well, and it kind of fits that old anecdote, right? Like the children will save us.
Kids are all right, man. The kids are all right.
Well, and Danny, last week we talked about, in the Paramedic 3 trial, they had 70% patients who had bystander CPR done. With that, the problem was that they didn't have any AED availability.
Right.
So what this speaks to, and what's encouraging to me, as horrifying as it is to think that we have to teach children how to do CPR, similarly, it's just as horrifying to think that we have to put kids through mass shooter drills. So back when you were in school, they had nuclear bomb drills, right, Dan? I like to have fun. So, but in this study said, I just want to go over the patients or the providers they actually looked at here. Because again, pretty decent split between male and female, pretty decent split between 4th and 5th grade. And we have ages 9, 10, 11, and 12. And again, a pretty fair split through there. And then they go into, and what I love about this is the post-test that these kids had to answer. Now, I don't know if any of you remember what it's like being 10 years old, but I didn't like taking tests at 10. And I feel like getting an exam that starts with your heart is a large muscle would be very stressful to me. But it turns out they had 96% retention on these things. They didn't know, like, electricity was a little bit misunderstood, which is fine because they're 10. So all the important stuff, right? Like doing compressions, how long do you do CPR? They had 50% retention here. They had a little problem with how fast they should do it and how deep they should do it. But again, If you found someone who needed CPR, would you know what to do? 97%.
Listen, we have paramedics and physicians who have that problem. Have you ever taught
100%.
CPR
Yep.
class?
No, exactly. But what, again, the important stuff here is we have, if you found someone that needed CPR, would you know what to do? 97%. If you found someone that needed CPR, would you be willing to do CPR? 96%.
That's
So,
great.
at the risk of throwing out the good in pursuit of the perfect, this is phenomenal, right?
Yeah.
So if I can teach 9 and 10, 11 and 12-year-olds to do effective CPR, because again, consider the settings that 9, 10, 11 and 12-year-olds are often. They're often at sporting events, right? So that's where you have your HOCM, your myocarditis, cardiac arrest that we talk about every summer. You have kids that are in pools, which is very, very important, because if you have a kid who recognizes a drowning, that's a bunch of lives that are saved, right? Like you and I, Dan, have been on the truck together. We get called to a choking and are like, okay, what do you want me to do in the 7 minutes that it's going to take me to get there? Right? So these are new providers who are comfortable actually performing this intervention. Those little things, like maybe their timing is off like that, but fine. If it means that they're doing it 85% correctly and these patients can have better outcomes because of it, I am all about it. And so I think this paper, aside from being interesting, right? Like, hey, it turns out we can teach kids to do this. If I can teach a 10-year-old to understand and retain CPR, what am I doing when I have career providers that don't remember how to do CPR?
It's a pretty flimsy excuse, right? If a 10-year-old can retain this knowledge, we don't have an excuse as professionals. We need to be experts at what we do. If it's like that old game show, I guess. Are you smarter than a fifth grader? It's like, can you do CPR better than a fifth grader with 2 hours of training? If the answer
what a
is
fun
no,
station that would be. Imagine that being a station at a conference. Trademark, copyright, trademark the Overrun.
Waka waka.
But no, like this is something that, friends of our show, Dr. Peter Antevi comes to mind, where he's been saying this for a decade, that, he can teach his kids how to effectively do CPR, how to give, his kids know how to give EpiPens. And that is a very specific example, right? You have a top tier physician who is a thought leader in his industry, and he's teaching his children how to take care of themselves. Fine, great. But the point of it is, of course he does, right?
And if you've ever talked to Dr. Antevi, that's how it is. The kids know how to do CPR.
Oh yeah. Yeah, it's one of the first things that I'll tell you. But this kind of supports that argument, right? Where if we're going to get into a time where we're worrying about improving resuscitation, improving outcomes in cardiac arrest, you have to start addressing people when they're young, when people when humans have that neuroplasticity, and it's something that they can stick in their head, right?
Sure.
Because I'll tell you something. So one of the things that happened to me was when I got sick at 13. So I don't remember a lot of stuff that happened before I got sick, but I remember going to DARE. You know what I mean? Like I remember those programs. Now, I didn't learn anything from them, but I remember going to those programs, right? So it feels like, at least to me, I can get a group of kids together, teach them how to do hands-on CPR. Like, can you count to 10? Great, then you can count to 100. Let's get down, you do these compressions hard and fast, and that's it. And you can gamify it to make the kids more interested in it, make it seem like there's a win and loss, column. And you can turn it into, like, remember when we had field day? Turn it into like a field day event. There's so many ideas for community outreach for how to improve outcomes in cardiac arrest. And now we actually have data to support, teach the kids how to do it, because they're the ones who are going to be home when their parent has a sudden cardiac episode.
Oh yeah. And here's another thing. If your 10-year-old or 11-year-old kid can memorize every lyric of Taylor Swift's On the Eras Tour, they can do CPR. Come on, Tay.
Talk about a generational event.
Tay-Tay's down. It's what it is. Let's do this. This is really cool for any educator.
I'm sure that she has a bunch of songs on that Spotify playlist too.
Yes. I think Shake It Off is like 110 beats a minute.
It's got to be.
It's got to be, right? But yeah, this is something that we should be showing to educators, to school systems, to anybody who's in that world of educating kids. This is something they need to learn. This is an important thing. And if we have more people out there maybe the cardiac risk survival rate goes up because we have more bystander CPR. We won't see it for a while, but it'll be there.
Yeah, and I think it makes sense, right? This is where you get the medicine versus politics debate, right?
Well,
I think that this is the kind of data set that you can bring to a school and say, you should involve CPR in your curriculum. Now, what's interesting is when I graduated high school, I had to take CPR to pass high school. And my assumption was always that was the kind of the standard bearer. That's not the case. So, put CPR into the curriculum.
I believe in our state specifically that there is a rule that it's part of the curriculum, which is great. Right. But again, it's that hard carrying thing, like the whole course. Mm-hmm. This is a couple of phys ed classes. This isn't hard.
Right.
And doing it once a year, and this is really good stuff.
And just to be clear, I went to high school at a Jersey Shore town, so we all had to know CPR because there was a fair to good chance that we were going to experience a drowning. We all live near the beach. So I can understand if you're in a school, in the middle of Iowa and they're not teaching you CPR, but they should be, right? So, and again, what really impressed me about this was just finding out, like, we can take a 10-year-old, we can teach them CPR, and they can at least effectively understand the simple mechanics of CPR. Because if you can teach it to a 10-year-old, you can teach it to a 20-year-old, you can teach it to a 30-year-old, you can teach it to a 40-year-old. And there's nothing really stopping us from doing that. But we want to know what you guys think. Let us know if there's any initiatives in your towns to have CPR in the schools. It's super, super important, and certainly something that Danny and I are probably going to start advocating for in our areas. Let us know what you all think, and let us know what your experiences teaching younger people has been. Check us out on Apple Podcasts, Spotify, YouTube. Check out the news articles on EMS One and subscribe to everything we have. For the Overrun and Monday Afternoon Journal Club, Ed Bowder and Dan Schwester, and we'll talk to you all next week.
Take care.